The NSNA would like to thank the National Council of State Boards of Nursing for their support in underwriting this program.
I can't think of another profession that offers more diversity than nursing.
Nursing is such a global profession. You can work anywhere in the world that you want to.
My job's different every year, and I love it. There's always something new happening.
I feel like I'm just in this ocean of opportunity that I could go any which way and be happy in any place that I chose.
A career in nursing offers you unlimited opportunities and a lifetime of growth. There are virtually no limits to what you can do and how far you can go. You can enter nursing school as a certified nursing assistant, an emergency medical technician, a licensed practical nurse, or from another career, and advance to become a registered nurse and nurse specialist. The key to unlocking these opportunities is continuing education. Nursing is a lifetime of challenges and rewards, career advancement, personal empowerment, and the simple joy of making the world a better place.
It's not important where you come in to the educational arena, but it's where you eventually exit.
It's very energizing to realize that where I start out doesn't need to be where I end up.
As you mature and, hone your skills, then you realize, well, I thought I wanted to do this, but maybe now I want to do that.
The healthcare needs of today's patients are far more complex than they've ever been. New diseases, new viruses, new treatment modalities, even new technologies will all place a greater demand on registered nurses. Advancing your education will prepare you to meet those demands head on.
We need that broadly educated nurse and the best educated nurse at the bedside, because patients are now sicker.
In order to understand the complexity of care, tells us that increased education on many, many levels is absolutely imperative for the nursing workforce of the future.
If you're going to be part of an interdisciplinary team, you have to be able to have the credentials and the knowledge base to be able to contribute to that team. And that's why it's so important that nurses go on. If we're going to get to the tables where the decisions are made, we're going to have the credibility to be there.
I think that if you look at other professions who have been highly successful in making our country stronger and really strengthening their discipline, they did not stop at the first degree. Everyone moves forward, and I think that nursing should do no less.
A great way to enter nursing is with an associate degree or a diploma, which provides an excellent foundation to build upon. Advancing from an RN to earn a bachelor's degree and master's degree prepares you for more responsibility and even greater recognition.
We know that is where
with a bachelor's degree, you'll learn more about pathophysiology. You'll learn about research and how things that may exist in the research field can be applied more effectively to the bedside.
You're going to learn more critical thinking and ways to look at patients and ways to use evidence-based practice and how to make sure you're doing the very best thing for your patient.
If you really are interested in moving forward in nursing, that you spend your time on a baccalaureate degree, because it will be time well spent.
Once you go into education and you begin to get more knowledge, then your ability to approach things from a different angle increases, because now you have a whole different skill set to bring to it. You cannot use knowledge you don't have.
As you've just heard, earning an advanced degree has many benefits and will prove invaluable to you in providing patient-focused bedside care while helping you climb the clinical ladder to new heights.
Anybody that really has a passion for learning, when they get to a certain point that those skills are developed, they want to move to another level. And clinical ladders assist and encourage nurses to do that.
But a clinical ladder is something that magnet hospitals are focusing on to be a motivator to nurses to continue their education. And you start at a basic level and you have to meet certain criteria to climb the ladder. And with that also comes a pay increase, so that's also a motivator for a lot of nurses.
We need many great nurses to stay in the clinical area and be seen as mentors, as experts, and also to be regarded as individuals that we want to financially reward or reward through status. And clinical ladders are a really good way to do that.
The opportunities available to you in nursing will most certainly increase with your education level. There are an abundance of clinical specialties available that will keep you challenged and motivated.
My opportunities are numerous once I begin to move on in the profession, to move on to have a master's degree, to become a clinical specialist or a nurse practitioner, to have some independence in practice, and to specialize.
But you find when you get to the clinical nurse specialist and the director positions that the world is your own. The recruiters are calling you every day.
The really good thing about the clinical nurse leader role is it has not been well defined. So these young people coming in that have their own ideas can develop that role into anything that they want. So that's a very exciting thing for those nurses that want to be entrepreneurs. A clinical nurse leader role might just be the way to do that.
You can become an advanced practice nurse in midwifery or anesthesia or a nurse practitioner. You can go on to pursue a law degree and be a nurse attorney. You can enter healthcare administration. You can work for professional nursing organizations.
If you're an associate degree nurse, it's not going to put you in that path. It's going to limit what you are going to be able to do in terms of roles and functions that you may really thrive in.
Another way to achieve recognition and advancement and to stay current with evidence-based practices in nursing is through certification.
Staying current with what's the latest evidence-based practice and knowing what provides the best outcomes for your patients is just really important in a field that's just constantly changing.
It means I've got the knowledge and skills that I need to take care of that group of patients. And I think certification is a great thing for any nurse. Really validates you've got the knowledge you need.
You could say to the world that you were beyond your minimum educational requirement. You were beyond licensure. You were ready to offer your services in a particular specialized area directly to the public.
The opportunities that nursing can provide are limitless and are bound only by your desire to pursue continued education.